Today I'm going to show a couple techniques for treating the TFL muscle and the adductor magnus. Now these muscles are direct antagonists of each other. So I'm going to treat the TFL first. It will often block an adductor magnus stretch. So I like to treat the TFL first. I'll show you how to do that with ball compression and contract, relax, stretch. So the easiest way is to be on the floor and take a lacrosse ball or some other hard, dense ball. And basically the TFL muscle is it's a hybrid hip flexor and abductor. So it does this. It flexes the leg, flexes, and brings the leg out away from the body. So like that. So abduction and flexion. So it runs from about the ASIS at the top of the hip. I can feel the very front of my hip here. From here to the trochanter, which is this round bone here that's part of your femur. So it attaches in a strip about like that. So I'm basically going to get the ball right in that area. So I'm not totally on the side. I'm a little bit more towards the front of the hip. And you know, a lot of times you can just palpate through here and feel where there's like a hard ropey thing. I'll use the ball probe to do that, to palpate with, and I'm just going to roll it slowly back and forth like this, or move my body so it's like the ball is doing that. And basically I can find a hard bundle of muscle fibers right underneath that ball. And I'm just going to move a little bit until I find something that's really tender locally or starts to send some pain other places. Now TFL muscle, it'll send its referral pain into the side of the leg. And it can also feel like it's like there's a deep problem in the hip joint. So it kind of puts this focal pain like right deep into the hip joint, and feel like there's a serious problem there. So what I'm getting here is I feel the tenderness locally, and then I also feel it go down the side of my leg, the side of my right thigh. So I'll just find the most tender spot and just let my body sink into the ball. So it's like I'm letting my body weight sink down. It's like I'm wrapping those muscle fibers around that ball with the exhale. It's giving them a little stretch against that compression. And so that's some good stimulation for those trigger point fibers. And then I'm going to move a little bit. I might find something else in here. So you can explore that a little bit with the compression ball. Now this is how you do the contract, relax, stretch. So in the same position, basically I'm going to take my back leg, this one right here, my right leg, and I'm going to try to push it through the floor. You know, it's not going to go anywhere, but if I try to do that, basically that's going to engage my glutes and my TFL muscle. So I just want to engage that TFL muscle. So I'm going to push down against the floor, and so the muscle's engaged. I'm going to hold that engagement for about 7 seconds and take an inhale. And hold. And then on the exhale, I'm going to let the hip relax, and then I'm going to push myself up with my arms and keep my leg in that position. And so that's what that's doing, is that's going to increase the leg adduction. It gives me a stretch of this TFL muscle. So I also am going to turn my body a little bit towards the mat and push myself away like that. So it takes a little bit of experiment. Like this feels very much like I'm getting a stretch on the side of the hip. I want it to be a little more into the front. So I'm going to turn myself a little bit that way and push myself up. So this can be a good stretch for some people. For some people, I mean, the TFL muscles really a tough gristly muscle, so you might not feel stretched. You might feel more stretch in the torso here, like what I am, or you might feel some cramping here because this side is shortening a lot. So if this stretch doesn't work, here's another one. So here's the muscle I want to stretch, running from here to here. So if I lunge, that's going to provide some stretch. It's going to get all the hip flexors, but it's going to get this one. Now, if I want to target this stretch, this a little bit more, basically what I can do then is I like to put my arm up like this, and then I'm just going to rotate my pelvis. So when I'm doing that, my leg is here, my femur is in the same position. Here's the top of the hip, the muscle is running like this, and when I do that rotation, I'm basically moving this point away from here, so that's going to add some stretch, and at the same time, I go into that hip extension a little bit more by deepening my lunge. So I'm going to back out of that, do the contract, and then do the stretch, okay? So then the stretch is going to be, well, the contract is going to be, I'm going to isometrically engage my TFL by pushing my leg this way. So I'm bringing it forward and also out to the side a little bit against the mat. So it's like I'm kind of dragging it against the mat. It doesn't need to go anywhere. But that movement, or lack of movement, but engagement, will engage the muscle and get it active. And I want to activate it first with that engagement. So I'm going to do that right now. So I push my knee this way. And you can feel that. I can feel the muscle engage right there when I do that. So I'm going to do that and hold. I'm going to take a big inhale and hold. And then I'm going to relax. I'm going to come into that lunge deeper. I'm starting to feel kind of a stretch all through here. So I'm going to target this TFL muscle here. I'm going to lift my arm up like this, and then I'm going to rotate. I can even bring my arm across like this and use that against my leg. But I don't want the rotation to be just above the hip in the spine. That's where it wants to go. I want the pelvis to actually move. If my pelvis moves, that's going to increase the adduction on this leg and give this thing more stretch. So you kind of have to tune into what's going on here to maximize your stretch. And that's actually pretty good right there. I can feel a really nice stretch in that TFL. You might feel the pain response from the muscle. You might feel the referral, which would be deep in the trochanter, or you might feel it kind of go down the side of the leg. So that's option 2 for the stretch, this low lunge type position. Another thing with the low lunge stretch for the TFL, if you have a vibration tool, you can always get vibration on it, as stimulation while you're, instead of the ball for compression, or it's really great, especially on the stretch. So my favorite combination for self-treatment is actually, I like to use the ball to get some really deep compression on the muscle fibers, and also help me identify where exactly they are. And sometimes I generate their referral pain, which is very informative. So I like to do the ball compression first. Then I'll do the vibration on the stretch. So basically, I'll do that now with the contract, relax, stretch. So I'll just get this going first. Okay. So here's that TFL stretch once again. I'm going to move my leg out at a 45 degree against the mat. So it's really going to light that TFL up. So it's engaged. I take a deep inhale and hold. And exhale, I'm going to deepen my extension, get the vibration going on that muscle, and then I'm going to rotate my torso away from it. That's going to increase the stretch. And I might pull out of it a little bit like that. I'll back out and I'll go back in. getting the extension, good stretch feeling, and then I rotate my hips a little bit the opposite direction. And that's a pretty good stretch right there. The vibration will tend to let you go a little bit further. It provides a distraction to the nervous system. So it's not like you're trying to like crush the muscle with it or anything. It's more just the vibration gives the central nervous system another input, another thing to think about and kind of mask a stretch pain. And then you can actually get a little more stretch out of those trigger point fibers, and that's what you want. Now we'll treat the adductor magnus. So adductor magnus is the direct antagonist of this TFL, where the TFL is a flexor and an abductor, and it's also a medial rotator, but that's a minor component of it. It's mostly a flexor and an abductor. So a direct shortening of TFL is going to be like this, and it doesn't cross the knee joint, so I don't even need to do that. So that's going to be really shortening the TFL. And the opposite movement is going to be extension and adduction. So that will stretch the TFL, right? And that's what we just did. But this also is a direct shortening of our adductor magnus. So adductor magnus shortens because it's an adductor and an extensor. So the TFL shortening, if we go this way, that's going to be a great stretch for the adductor magnus that lives here. So the adductor magnus is known to put referral pain into the groin and down across the medial thigh. Okay, so it's a lot of people will, anytime you hear someone say they pulled their groin, or that's usually adductor magnus or adductor longus referral. And it often happens during sports for people when they're doing a lot of lateral movement. So like soccer, football, anywhere where you're making fast cuts left and right, tennis, stuff like that. The muscle, the adductors are doing that, as well as the glutes stabilizing. They can get overworked, they can get chronically overloaded. Or also if somebody is on ice or a slippery surface and their leg moves out from them like that, the adductor muscles are trying to restrain that leg from just flying out. So they're trying to engage. They're engaging and being lengthened at the same time by an overwhelming force. That'll cause trigger points acutely, and then the person will have groin pain. This is how you treat that sort of thing. I would treat the TFL first, and then we can treat adductor magnus. So here goes magnus. That magnus will also refer through the longus into the medial knee. So that's also a pain possibility. If I was treating on the ground, I might use a yoga block to get compression on the magnus. So the magnus lives, it attaches to the pubic bone, and then it has attachments into the femur and all the way down here to the medial condyle of the femur. So it's a huge muscle back here. People think that this is all hamstring. This is mostly adductor magnus in the posterior thigh. The hamstrings are usually pretty thin, superficial to it, overlaying it. So the meat of the posterior and medial thigh is the magnus. So basically I'll get a compression ball like this, and I'll try to get it on those fibers. I'll cross fiber this way. And if I'm on the floor, I like to put it into a yoga block, and then I can get the ball in a position, and then I can kind of just roll onto it. So I'll immediately rotate my leg a little bit. And then once it's in a kind of a rotated position, I'll just let it relax. And then I can just actually use my hips to kind of just move the leg. So I want the leg to be relaxed as I cross fiber the magnus. Now right there is a pretty tender fiber. And it's actually, I can feel the referral going right up here. That's common. So I'm on something good. If I was experiencing an active groin pull, groin pain problem, this would be the first thing I would be targeting. I would look for the hard fibers that are actually causing that referral. And when you find muscle fibers that actually cause that pain, then that's actually a good thing. Then you're on the right, you're on the right thing. So I would just kind of hang out on that. Breathe into it. I might look for go a little more posterior. So I'll go not quite its medial and see if there's anything back there. And you can explore anywhere here close to the pubic bone all the way, further down to about medial thigh. I could find something down here maybe. Oh, there's something. Yeah. So this fiber, actually, I feel it here, and I also feel it up here. So that's another common thing, is that the adductor magnus will refer into the longus, into the medial thigh area. Some people feel it into the knee as well, but it'll also refer up into the anterior hip. Okay, so after that compression, now I'm going to do the contract, relax, stretch. So I like to do that as a happy baby pose, or half happy baby pose, or some people call it lizard pose, or half lizard, supine lizard. It looks like this. So just did the compressions here. Now this is going to be a direct lengthening. My leg's going to come outside of my hips a little bit towards my shoulder. So it's abducted, and then it's going to come down towards the mat. So that's going to add more flexion. That's going to be a big stretch for the magnus, and it's also going to be a big shortening for the TFL. So basically what I do is I go like this. So I have my arm on the inside of my leg, and then I also can grab my heel, right? So if I'm pretty flexible, so if this isn't doable for you, I'm going to show an alternate way to do it, so don't worry. All right, so this is like the yoga way to do it. Okay, so I am in this position here. Now I'm going to push my leg this way into my arm and push my heel into my hand at the same time. So that's really lighting up my adductor magnus and also my longus. I'm going to take a big inhale and hold. Then I'm going to relax, and then I'm going to bring my knee just outside of my shoulder, and this is the big stretch, right? So I keep my knee flexed at like 90 degrees, and then I basically just pull my heel down towards the floor, and I'm getting a huge stretch through here. So you might feel the stretch. You might feel medial thigh pain, medial knee pain on the stretch. That's possible. You might also feel cramping or something happening here. So if that's happening, you could switch hands and get a thumb in that TFL, because the TFL shortening is the thing that's going to be blocking your stretch, right? So you could get a thumb in there like that. So I got my thumb in there. Or if you've got a vibration tool, you can do that. So I'm going to get the vibration on the stretching magnus and on that shortening TFL. I'll just alternate. Okay, first I'll do the contract, relax. So pushing in, pushing through my heel, inhale. And exhale. Let myself relax, pull the knee down. Get the vibration on the magnus. Yeah, now I'm not really feeling that stretch anymore because of the vibration, but I am feeling some cramping on the hip. So I'm going to switch this around and get this here. Use the other hand. And I can just let this rest on the mat. So that's a good way to do it. Now, if you're not as flexible, or you might want to use a chair, I'll show that method as well, because that actually is an easier way to do it in a lot of ways. It's the same type of thing, except now I just have my leg up. So instead of me laying down supine, I'm standing, and basically if I do this, that's the same thing. My knee is going outside of my shoulder, and I'm going into more hip flexion, and that's going to give me a big stretch here and a big shortening here. So that I would just do the same thing that I did before. I'm going to get my vibration tool handy. So if I'm doing it the contract relax, then I'm just going to put my arm here, and I'm just going to move my leg into my arm, and my arm blocks it, and then I'm also going to push my heel into the floor. So that's really lighting up my Magnus, and I can feel it all engaged back here. Take a deep inhale and hold. And then I'm going to relax, and I'm just going to take my torso forward. And I'm getting a huge stretch in the Magnus. And then of course I could always add the vibration on the stretch on the Magnus muscle, or I could put it up here in that lateral anterior part of the hip to get vibration as a nervous system distraction on the shortening muscle, lengthening muscle or shortening muscle. So the TFL and the adductor magnus, very important agonist-antagonist relationship. Those are two important gait muscles used every step you take. And when they get into trouble, if they get into trouble, this is a good way to treat them. Treat the TFL first, then treat the adductor magnus. And so I just showed you how to do that with ball compression, with contract, relax, stretch, and also using the vibration on the stretch. So I hope this video helped you out. And I'm going to be doing more of this content. And so if you'd like to be notified of when I post a new video, go ahead and subscribe. Thanks.